So hi, Ameeta, and thank you for making yourself available, Dr. Ameeta, in the middle of your night shift on a Tuesday night. So Dr. Ameeta is an intensivist with the Good Samaritan Hospital, California, San Jose, California, and she's both certified in pulmonary medicine, internal medicine, and intensive care medicine. So welcome, Ameeta, and welcome to our second interview for the Mosaic Project. So Mosaic Project really empowers people to become whole again. And so we focus a lot on topics related to mental health and well-being. And during this situation that we all are in, which does not require an introduction, I was very curious to know, and I've been following you on Facebook, to know what really is the state of those who are at the front line of this epidemic. So a lot is being talked about how people like us, regular people, are dealing with it. And I think what's not being talked about is, of course, you know, the people on the front line, the doctors, the nurses, and so many more. The first responders are in this, but really what are they going through? And so I wanted to start off with asking you really, what's your typical workday look like and how has it changed during these times?
Okay, so as you know, I'm an intensivist. I work only in the ICU, and a typical workday is a 12-hour shift. It could be day or night. It's usually intense by definition, but this pandemic has made it just exponentially more so. So we're seeing sicker patients, and they're crashing faster. Oftentimes there's not much we can do because the disease is so severe, and we know so little about it that there's not much to do other than just support somebody through it. And there's just this constant sense of helplessness, which I wasn't familiar with before, because we always knew what to do. There was medical evidence-based medicine guiding what we should do. But these last 5 months have been unprecedented because we don't really know how to tackle this virus. It attacks all your organs, and most things that work for everybody else don't work for patients with COVID-19. You were asking how we're feeling about this. Well, other than the helplessness, I think it's 5 months into this, I feel that some of us, physicians and nurses and respiratory therapists, are starting to kind of have this sense of mental fatigue. There's an analogy that I was thinking of earlier, that in the ICU we call it alarm fatigue, because there's just alarms going off at us all the time in the ICU. There's ventilator alarms, there's IV pumps have their alarms, there's security alarms, call lights. So just all these different alarms going off all the time. In a larger sense, there's just, we're not really seeing any end. We had a small blip of hope when the curve started to flatten just a little bit. We were hopeful that maybe we've got a handle on things, and then I think it just went straight back to worse than before. So we're having more cases and more deaths in the last couple of months than we did in the first few months, which is disheartening. So I mean, that said, we do what we can, but we feel like if there was, we feel like the general public is not quite getting how bad it can be. Mm-hmm. Until some friends or family dies, people don't appreciate how bad this illness can be. It's not just the flu. It's not just being at home in bed. It kills, and it kills really fast. But as time has passed, that it affects middle-aged, younger people, people without comorbidities, people, athletes, and now more cases in children are coming up. And we're finding out that children tend to carry the virus more easily than adults. They may be better carriers for the disease. But there's new data coming out now that the rate of hospitalizations in children is actually very similar to those in adults. So they're not. We shouldn't be so complacent.
That's right. And so, Ameeta, I think by virtue of your profession, you're already in this environment, which is a constant fight or flight action when you're at work, right? But what I'm reading is that this has becomes this situation. And I think by virtue of that, as it is, doctors undergo a lot of stress, they face anxiety, they're sort of dealing with this as part of that, for lack of a better term, as an occupational hazard. Uh, but now with this situation, it's almost being compared to going to combat, that level where the PTSD, the post-traumatic syndrome, a lot of doctors are facing this. And first is the situation, the fact that it's unprecedented and it's, growing exponentially, there's no hope in sight. And then, of course, the feeling almost of a bit of a betrayal by the system, by the people, where they're, whether it's lack of enough of protective gear or whether it's people not just getting it in terms of, how important it is and how this is not similar to a flu. So what's really going on there?
Exactly those 2 points. First of all, I feel that I know that there are attempts made about the healthcare system and healthcare workers, but it doesn't even begin to touch the magnitude of the things that we do need. The PPE. A lot of people are getting their own and spending their own money to get PPE to protect themselves and their family. And secondly, it's not just the PPE that is an issue. It's the fear of taking it home to your own friends and your family. And then also the third thing I think is disconnect, that you feel that you're in this battlefield, but nobody gets it, right? Just like you're fighting this imaginary battle, apparently, watching people die and crash in the ICU. But when you step out of the hospital, people are living their lives normally without any social distancing and not fear in the world. And I just imagine like how things can turn around very quickly for them in a very bad way if they continue in this manner. So it's again this frustration, is this sense of lack of support, and again just again with no end in sight, essentially.
Right. And like you mentioned, in terms of being able, also being wired. So first of all is the job, and the second part is, what are you getting home, and how are you managing that transition to being back to a mother and a wife when you get home? How is that, like, logistically as well as mentally? How are you able to integrate that into your life, or are you able to?
Not managing very well. Well, no, I think that as a professional, you just have to learn to do what you have to do at work, and almost, turn like a switch off in your mind at being home, saying, that's done. I did what I could, and now I go home and enjoy my family. I think we have a sense of gratitude now, a sense of being more thankful for the things we have, things I never appreciated before, that I have a healthy family and my husband and kids are healthy still. So just that helps, I think, keep us centered, is to count our blessings, our everyday blessings that we never acknowledged before. I think that that's what's helping set up some sense of balance in this chaos.
Mm-hmm. So how do you, so when you get home, like what do you really do? I'm curious.
Oh, the nitty gritty of it. So yeah, there's actually a huge decontamination process going home. So when I come into work, I change immediately out of my home scrubs into hospital scrubs, and I have a jacket. I have this scrub cap at all times when I'm out of this. Right now I'm in my office, which is just me and nobody else enters or exits. So I don't have a mask. Otherwise, if I step out of this room, I have a full face shield. I have a N95 mask on. And so the same decontamination happens when I go home. I change out of these scrubs before I reach home. I change my shoes. The hospital shoes don't enter my car. As soon as I get home, nobody can touch me. I don't touch anything. I go straight to the shower. I throw all the clothes for wash home, to kind of making sure that I'm not bringing home the virus. And then when that's done, then I'm basically back.
And being aware that you have to switch off, if you're going to continue, and sort of being able to appreciate just what you have and the family that you have and the support that you have. Apart from that, are there any coping mechanisms that you or people in your team are relying upon or becoming more acutely aware of, that's something that is required?
I haven't definitely, but I know that there are groups that support groups that people are making, and have physicians, so that if you want to share your experience or just have a group of people to talk to that actually are going through what you're going through. Zoom groups, I think that's really helping people decompress and kind of have an outlet to know that other people are going through the same thing. I personally do some yoga or spend time in the backyard to decompress.
How's your family taking all this? What are the kind of conversations you're having at home?
Kids are fascinated, because they're aware that there's a virus out there, and so mom won't let them go out or play with friends. And there's no school. Schools have opened up, so they always want to know, what did you do today? Who did you see today? What did you do for them? So that's kind of like a ongoing excitement, adventure for them to know what's happening out there.
Do you share with them the details? Like if someone did slip away, is that something you're able to share with them as a parent? Or
I know that I do share with, somebody came, I keep it very bland. Somebody came in sick and we had to help them breathe. We had to put them on a machine to help them breathe, and they didn't have blood pressure, or their heart was too weak to put a line in their neck to give them medications. But I'm not able to share yet. I think it's just hard for me to process that myself. And every time I talk to a patient's family, it's like reliving that kind of trauma, that what they're going through. You feel what they're feeling, and every family that you update throughout the day has, for them, it's personal and real and very much painful. But every time I have to share that with every family, kind of, I feel it too. So the last thing I want to do is go home and relive it with the kids again. So I try to compartmentalize it and just leave the painful things at work. But I do give them some little tidbits here and there without rehashing it.
in terms of the community, and I know there are a lot of these things that happen in the community, right? Whether it's and I don't want to make the India reference for the whole clapping, but they're just ways for community to get together. We had the Thunderbirds, right? Where we had these planes in the sky, and a salute to everyone on the front line. What's your take on it?
I think there's two polar takes on that. Mine is that it was a huge waste of energy and time, and it's like that meme that you see of the drowning person. The only part of them that sees a little hand coming out, hoping somebody will grab that hand and pull us out of the river. And instead, what they do is give us a high five and then let us drown. That's what that felt like when they were flying overhead. Okay. I mean, I think there's money that could have been spent on actually sending me some PPE, perhaps.
And do you feel supported by the community, whether it's friends, family, people in your neighborhood? I know that you're continuing to social distance, but just in terms of, what helps maybe you or your colleagues during these times?
So yeah, I definitely feel supported by friends, family, and my neighborhood, my community. I think what helps is just the basic respect of social distancing rules. If the general public, if everybody just understands this, we're all in it, and if we could just do this, we're helping ourselves. We're helping sicker people not die in the hospital from a preventable, communicable, infectious disease. All we have to do is social distance, just avoid large gatherings. If people could wear their masks when they're outside and wash their hands, that would signify to us that is support and solidarity with us. If people could just follow these basic steps, I think that would be much more valuable than any aircraft flying overhead.
And if there's anything apart from continuing to social distance and wash your hands, if there's any message you wanted to put out there, what would it be? A heartfelt.
Yeah, my message is, first of all, social distancing, please. Do the basic things. But on a personal level, I think that we need to work on everybody's mental health, not just healthcare workers. We are all pretty mental health. So just kind of work on yourself, on your health. Get rest, get exercise, have good nutrition. These are the basics that we can do to boost our own natural immune system, so that even if you do get sick with the virus, at least you're healthy and has good reserve to fight it. That this is what we can do on a personal level, and stay connected with your friends and family, check in on each other, and that human touch that we haven't been able to have. If we could just overcome this digital age with Zoom meetings and FaceTiming or WhatsApp our friends, I think that we might make it.
Thank you so much, Ameeta. I know you are in the intensive care unit, so I want to be respectful of your time and really thank you from the bottom of our hearts for everything you and the rest of the frontline workers do.
For letting me say all these things. So thanks a lot.